don't let other businesses get a piece of the pie as well, for example, but do it locally in your area, for example, and then you do webinars. You could do that every 2 weeks, for example, for those that can't get out. Arrange to do like days out, like, you know, during June, for example, when it's not too hot, you know, just to get, for them to get out for the day. You can collaborate with a day center or collaborate with a sheltered housing center, for example. Do that and you can get to meet people that way. And at the same time, you invite the sheltered housing manager, you invite the social services, you invite the general practitioners, the surgeries, for example. You invite the recovery teams, you invite the mental health teams, you invite the elderly teams, you invite the adult teams, for example. Build this community because there's not enough people doing it. I'd love to hear your comments, whether you've seen it, where you've seen people do this, because this is how it used to be, and we need to really look at also going back to basics in a way that's comfortable and really just looking at growing your connection with your community, because I'd love to hear from you in the comments. Do you know your community? Do you know the people in your community that you're serving, apart from the clients that you have and apart from where social services have referred someone to you, for example? Do you know who is literally in your community? I bet you don't. And this is the reason why I'm doing this live tonight, is because there's not enough people doing community events, for example, whereby you're talking to those that need the service and how you can best support them in their lives, to give them better outcomes, to give better care, because you understand them, but also you know them, you've met them before you just walk into someone's house and it's the first time you've met them, for example. With this way, they know you and you know them, and that's a better combination. It doesn't feel so awkward when someone's first going into a house, for example. So I'd love to hear your comments about what you are going to do. Is it something that you're thinking of doing? Are you interested in building a community? Are you interested in finding out what your community needs in your locality? Because this will also help you to get a contract. It will help you to get a contract because this is what you're doing, and then you're then able to put on your contract that I initiated a community, care community in my locality, and I started 6 months ago, for example, and it started with 10 people.